All right, everyone. We'll get started then. Hi, everyone. Thank you so much for joining. Welcome to today's Wellness Wednesday on the topic of older adult mental health. My name is Lily, and I'm one of the program assistants for the BC Brain Wellness Program, and I will be your MC for today. Before we dive in, I do want to take a moment to acknowledge that the BC Brain Wellness Program at the Javad Moafean Center for Brain Health resides on the traditional, ancestral, and unceded territories of the Musqueam peoples. As a settler here, it's crucial to recognize the profound relationships we have with the Indigenous peoples and their land, and to continue to honor and nurture these connections. It is truly a privilege to be able to offer our program on Musqueam land, and I know we're probably joined from various locations today because we are all on Zoom. So if you want to learn more about the land that you may be residing on, you can do so through the resource provided in the chat. Let's move on to introducing our lovely speaker today, Dr. Nelly Oelke, who we are so grateful to have join us today. Dr. Oelke is an associate professor at the School of Nursing at UBCO. She is also a scientific director at the Rural Coronation Center of BC. Dr. Oelke is a health services researcher with a focus on primary care, primary health care, interprofessional teams, mental health, rural health, and health policy. She has expertise in knowledge translation, integrated knowledge translation, deliberative dialogue, and patient-oriented research. So, in today's talk, Dr. Oki will share her work on fostering mental health conversations among older adults, healthcare providers, and care partners. Her work has led to the development of a toolkit now entering the testing phase across provinces. Dr. Oki's presentation will highlight the mental health continuum for aging adults, the toolkit, and approaches to starting conversations on mental health with community providers and adults 55 and older. And I would like to take a moment to thank all of our program donors for supporting the BC Brain Wellness Program. It is because of your generosity that we are able to offer these educational events and classes. So, as an entirely donor-funded program, thank you, thank you, thank you so much for your ongoing support. And just a couple of housekeeping notes before we begin. If you have any questions for our presenter today, feel free to type them in the chat box. If you want to ask your questions privately, all good, just send it directly to me in the chat. We will have a Q&A session at the end. And just a reminder to keep your mics muted throughout the talk. And this talk is being recorded, so it will be on our YouTube/, website within 2 weeks' time if you want to rewatch. In addition, we are actively recruiting for 2 research studies. So for our Impact 360 study, we are recruiting for healthy agers and those with Parkinson's to understand the health impacts of a combined virtual exercise, cooking, and mindfulness class intervention. So if you're interested, our email is impact.360@ubc.ca. Furthermore, we have a new dietary intervention study to understand the impact of diet on symptoms and the microbiome of those with Parkinson's. So if you're interested, our email is pd.diet@ubc.ca. And if you know anyone who may be interested in these studies, it would be greatly appreciated if you can pass these on. And of course, these interventions are at no cost to you. And lastly, please join us for our hybrid World Brain Day celebration. It's happening on July 23rd, Wednesday from 12 to 2 p.m. So in this event, we will focus on exploring the interconnections between the mind, well-being, and resilience throughout life, especially as we head into older age. We'll have an engaging session of presentations and activities with Dr. Julia Henderson, Sandra Joa, Maddie Mooney, and Cynthia Friesen. So it is hybrid, so please join us if you can, and we'll have the registration link in the chat. All right, and without further ado, I will pass the mic to our speaker, Dr. Oki. Welcome.
Thank you. I'm just going to share my slides. Just take a minute here. And of course, it's different than it was earlier.
I think you just have to press present on PowerPoint.
It's coming.
Okay, sounds good. Perfect.
Right. And now the screen people are over. I just need to move them off. Got it. I think I'm all good. Hopefully, everyone can hear me. Thank you for the invitation to present. Myself, and our team are very happy to be able to share the information and where we are at with this project, and also sort of what things might we want to do down the road with the outcomes of the project. So the project is called Co-Designing Action-Oriented Mental Health Conversations Between Care Providers and Aging Canadians in the Community. And so what we're referring to, care provider, is both health and social care providers. Oftentimes people who might be getting home care or that sort of situation, those are the care providers that we are working with. So personal care aides, and that sort of thing. So I just would like to acknowledge that I'm joining you today from the traditional, ancestral, and unceded territories of the Silks people in the Okanagan Valley. This is a photo of Skaha Lake for any of you who have visited the Okanagan Valley. It's closer to Penticton, and it's very hot here today. It's going to be 32. Yesterday it was 36. So we've had a lot of sunshine, and it's been lovely. And just also too would like to acknowledge the lands from which each of you come from across the province of British Columbia. So this is our research team, and our team lead is Justine Giosa, and she works with University of Waterloo and SC Health, which is an organization that focuses on health services for older adults. And then the rest of the team members at SC Health and University of Waterloo are listed there. And I'm from the University of British Columbia in Kelowna, as Lily shared. And sorry, and the research assistant is Adrian Peak for the BC project. And then we also have two people from St. Francis Xavier University in Nova Scotia. Katie Obrecht there is the lead researcher there, and Tatiana is the research assistant. So it is a project that's happening across 3 provinces in Canada. And then I also just want to acknowledge that the study was funded by the Canadian Institutes of Health Research and also from SE Health. So this is our agenda for today. And I know I've been given sort of about 45 minutes to speak. I'm not sure if I'll speak that long, so please ask lots of questions at the end. Happy to answer those. So I've already done the welcome and sort of introductions. We're going to do a background section just on mental health for older adults. This project specifically focuses on adults 55 and over. And then we're going to do an introduction to the research project and sort of where we're at the each of these phases, and looking at outcomes and impacts to date, and then just some concluding remarks. So just as a bit of background information, 1 in 3 older adults living alone state they have need for mental health care. And so that's really quite high. And 12% of seniors report feeling socially isolated. And this is information, but this became much more of an issue during COVID and has continued then to be an issue, but also really has come to the forefront that this is an important piece. So 5% of older adults access health services for mood and anxiety disorders, which is actually, I think, quite low. We would anticipate with 1 in 3 older adults living alone that they have a need for mental health care, that more people would actually be seeking services. And then when we're speaking about older adults in equity deserving groups and groups that, like in rural communities, which I'm very familiar with, and other communities like First Nations communities, or Black people, immigrants, those sorts of groups of people have much greater challenges. They often have greater challenges around mental health, but also greater social challenges such as housing and different things like that. Certainly in rural communities, we have limited resources in mental health, and so that becomes very challenging. And then the mental health of older adults is often overlooked due to other health and social conditions. So, if somebody is suffering from a medical condition, they have cardiac issues, they get focused on the cardiac pieces, and people tend not to focus on the other areas because they're oftentimes seen by a specialist, and the specialist then focuses on exactly on the concern that they're looking at. A lot of people also do not have healthcare like a GP, a family doctor, and that also is very challenging then. So, and then the social conditions, such as I spoke about, such as housing and other areas, low income. So many of our services are provided if you have the money, and that is a challenge as well. So, the system, as I said, focuses on physical needs and is very sort of siloed in some of those physical needs and doesn't sort of think about the overall mental well-being of clients. And there's a dual stigma with regards to help seeking for older adults. It is about the stigma around age and older age and aging, and then it's the stigma around mental health. And certainly, older adults feel that stigma around mental health much more so than people who are younger, middle aged, that sort of thing. The other thing that in work that we've done previously, is we know that people who live in rural communities really do suffer from that stigma with regards to mental health stigma, and tend not to seek services. So there's missed opportunities for integrated mental health support, care, and treatment. And this is the important piece is that the physical and the mental health need to be integrated together so that we're actually caring for the whole person versus just uh, only the physical need that they may have. Home and community care providers build trusting therapeutic relationships, so they know their clients. They know more about what's going on and those sorts of things. They don't have the training oftentimes or have the time. They're there to do the bath and then move on. And so that is a limitation with regards to being able to carry out conversations. So there is a need to build capacity and to develop evidence of what works to support home and community care providers to engage clients in mental health conversations. So this is a three-phase study, and I'll go through the phases, but the overall goal of the study was to co-design and test an evidence-informed approach to starting these mental health conversations between health and social care providers in the home and community care settings with older adults as well as their family caregivers or a friend who was a caregiver. So In phase one of the study, we looked at adapting and then validating that adaptation of the mental health continuum model. And I'll show you that in just a moment. It's a model that was actually used in the military and has been used in post-secondary education with students, but it's not been used generally, and certainly not used in for older adults. And so we revised that model so that it really fit aging adults, and that it focused more on home and community care. The second phase of the study was then to co-design mental health conversation processes and tools to be able to have those conversations. So what do you need in order, as a care provider, in order to have and start the conversation? It's often about starting the conversation, and then continuing on is easier. And then lastly, as Lily suggested, is where we're at right now, is actually testing the tools that we've developed, as well as further testing the mental health continuum as a tool to start these mental health conversations. So I do want to say that this whole project started with concerns. SE Health held sessions during COVID with older adults, where they could talk about, and care providers talk about what was needed. And this was the number one idea and suggestion that was put forward during that time. And so then they applied for funding, and we were able to get that funding. But on top of that, the whole project is led and or not led, but continues to work with a working group of experts by experience. So these are people who are older adults who might be providing some community-based services, but they are meet on a regular basis with our research team to ensure that we're doing things in the best way possible for older adults. So phase one, I talked about the adapting and validating the mental health continuum model. First of all, we did online workshops, and this was still sort of at the end of COVID time. And we did 4 3-hour workshops with 59 participants across Canada. Um, and they included older adults, caregivers, health and social care providers, and mixed. They included a mixed perspective. Now, I said across Canada, I meant the 3 provinces. Sorry about that. So those were the workshops that were held. One workshop was held in French, because we also ensured that we included French speaking people in from an older adult perspective, as well as caregivers. So that then helped us adapt the mental health continuum model and make significant changes. And again, I'll go through that shortly. From there, we had an online survey where we collected data for 5 weeks, and we had 1,068 participants. I can say that at least 250 of those participants were from British Columbia. And so we had a high percentage of people respond from BC, which we were very happy about. And so again, these included older adults, caregivers, and health and social care providers, and they reviewed the adapted mental health continuum model, and then provided feedback on that. It's interesting, the feedback at that point in time was very limited. They agreed with what we had done, and were really quite happy to see such a tool be available in the future. So this is the mental health continuum. And the on the left-hand side of your screen, you will see the green through the red, that real stoplight sort of effect. And this was the original model that was uh, put it together by the military, the Canadian military. And the other thing that you'll see is that it's quite um, it, it it focuses, so the whole green to red was something that really wasn't seen as very appropriate. Um, and so then, as you can see, we move to all good, take notice, find support, and also seek care. And so it became much more sort of community focused and much more focused for many different populations, but particularly older adults. And then we added and changed the names of the different categories on the left-hand side. And so thoughts and feelings and emotions instead of mood. We looked at daily routine and activities. That was what was decided. Sleep experience, that it wasn't just getting sleep, but it was all about that experience of sleep. And then physical observations instead of symptoms. So we also made the words much less medical and more lay language. And you'll see that through the whole piece. And then looking at social behavior, we looked at relationships, participation, and connection. And then instead of naming alcohol and gambling, we talked about habits, coping, and coping strategies. And you will see alcohol and substance use in there, but you'll also see other things that people do that get them into a situation where they're over engaged and become, regular users to cope in their situation. So the slides will be shared, it will be recorded, and you'll see, so you can use the QR code, and that's where you can actually access the current mental health continuum. And the other thing to emphasize is it's for multiple health and social care providers. It is not just for nurses, it's not just for social workers. It really is meant to be for all folks. And then lastly, it is not for diagnosis. This is a tool just to see where people are at and for people themselves to actually assess their own mental well-being, and then to think about where they're at and maybe thinking about, hey, I need to make a little change there. So this is, in a larger format, the mental health continuum. I won't go through any of this in detail at this point in time. It just is a bit word heavy. This is was a bit of my concern, and also trying to ensure that it was in a format that people who had trouble seeing or that sort of thing, that they could see that. So when it is printed, it is actually in a larger print format, and so has been helpful. So phase two was then to co-design these mental health conversation processes, and then actually create, hey, what do you need in order to have those conversations? So we had 7 5-hour workshops. So we have, in each of the provinces, we have at least one urban site and one rural site. In BC, we have one urban site and then we have uh, rural sites, and we have numerous sites in 3 different communities that are in one regional area. So most of the people who the health and social care providers were 51 zero point 0.5 years of age. They mostly identified as women. Many were born outside of Canada. And again, that's not unusual given that people who work in these types of roles oftentimes are new immigrants. Most identified as straight heterosexual. Most were identified as white. Almost a quarter, though, identified as Black. And then most live in urban communities. So we did a number of different activities. To think about an idea, we used a case study to be able to talk about that, and sort of storming empathy mapping, and then a discussion about the acted out ideas to be able to move those forward. And so these are just some of the artifacts and transcripts that we had from the different workshops that happened. And so that was a great amount of work in trying to analyze that and to come up with some common ideas. So some of the suggestions that were made is different formats. And so people felt that there needed to be a calendar. And so that, when you were visiting and starting a mental health conversation, that you could actually have, talk about what was it like for you last week? And people could actually document, when things went really bad or when they had a really great day. um, they were looking at living toolkits, they were looking at paper booklets, fridge magnets, thought maybe a podcast would be appropriate, and then also a notebook to actually just take notes and do that. And then they wanted the functions were they needed visual pieces. And so that was really important. They needed education about mental health. So the care providers themselves needed education about mental health. They wanted to be able to track mental health over time for their clients, or their clients to be able to do that. And then fostering communication, and then also facilitating self reflection for the client, but also self reflection for themselves and how they were doing in those conversations. So, the Mental Health Conversations Initiative, which is phase 3 of the study, has an implementation framework that looks at, what does the health and social care organization need in order to do this? And then, it was about creating shared understanding of mental health, and it's about identifying mental health needs and building mental health support skills among people working in home and community care. And again, the initiative is not for diagnosing, but it is for highlighting and then referring people as needed. So the implementation framework, these are some of the preliminary pieces, but it had an overview of the initiative. It had some change leadership messages, some testimonials from people who were in the workshops and in other areas, um, of what was important, and then guidance for implementation. So these were the sort of the background materials for the organizations themselves. So then we did training. We had an online training module that people just completed on their own. It was a 30-minute training module, and then they had an online group training for 1.5 hours to be able to practice having mental health conversations. So they actually did role play as well, and then talked about the study next steps. We have a mental health conversations guide that the care providers can use. It's a flow chart. How do you tailor your approach so that for one person, you aren't going to use the same things that you might use for another. And principles for meaningful mental health conversations. We used conversation prompts. So maybe this is how you want to start. How is your day going today? Um, uh, just a number of different prompts, and then a resource list as well. So this is the toolkit then, along with the pieces that we talked about, that was developed. So the Mental Health Continuum Guide is there for aging Canadians in a larger format. And so each of the clients gets one of these, but then the care provider also has a continuum as well to be able to reference and refer to. And we had so there is a how are you today, and so just a card and thinking about that. We had calendars, and then the stickers that you see in the very far right match the icons on the mental health continuum, so people could use the calendar to say, this is where I'm at today, and I maybe need some care and need to go forward. The little wheel was just capturing key pieces. The mental health conversation cards, when we delivered the toolkits, my research assistant and I went and did a road trip, and we had a conversation again with each of the organizations, and we delivered the toolkits. The mental health conversations cards were seen to be the most helpful, along with the continuum. So it'll be interesting to see what they think. And then there's also the fridge magnet as well. So it's about providing education about mental health. It's about helping people to track and reflect on their own mental health, and then to encourage conversations about mental health, both that first time that they go and or connect with that client, but also in subsequent visits, because they often are visiting those people on a regular basis. And then each of the toolkits are in a tote bag so that they can give that to the client or the caregiver, client and caregiver. For our study, we don't require caregivers, but they can be engaged if they wish to be engaged. So phase 3 is all about, is it feasible? Can we make this work? Is it acceptable? Are the tools helpful or not so helpful? What else is needed? Or what can we get rid of? And what are the outcomes for providers, older adults, and caregivers? And so we're interviewing care providers, obviously. We're interviewing leaders in organizations. We're interviewing older adults and also family and friend caregivers. And we're doing surveys for a number of these as well. And these are the organizations that are engaged and across the 3 provinces. So there's 11 partner organizations in rural, urban, in Nova Scotia, Ontario, and BC. So what do we intend on learning? So who delivered and received mental health conversations? So we want to know who actually people talk to. How was the initiative used in practice? How acceptable was the initiative to providers, but especially older adults and caregivers? And what were the barriers and facilitators implementing the initiative? And then overall, what were the early outcomes of the initiative on mental health for providers as well as older adults themselves? And our results will be used to refine the initiative, to refine the tools, and then we want to look at then moving that forward and sharing those tools to be used in other settings in other provinces as well. So what are the outcomes that we've seen thus far? So it's been the mental health continuum has been very, very well received. They said, "Oh my gosh, we really wanted one like this." And this is going to be so helpful. And they wanted to be able to use it as soon as we did the phase two um, uh, workshops. We suggested maybe we wait just a bit, but that they certainly could think about and, maybe use portions of it or whatever. So that's one thing. So that was obviously has been a gap and has filled that gap. The development of the potential tools support conversations. As I said, the conversation cards were seen to be really sort of very helpful. And so it will be interesting to see what that looks like. And we're looking at, different organizations with different populations. So these are the organizations that we're working on. They're very different across the province and across the three provinces. So that will help us learn a fair bit about what we need for different organizations. And then thinking down the road about different populations. We presented this information at an international conference, and we actually had people actually take on and say, "So, what would we do if we had this in emergency? What would we do if we use this for women with newborns? What would that look like?" And so we're looking at those sorts of things as well. And then there is such a lot of input from different perspectives here, as well as the perspectives of the experts in experience. And so that has been really helpful as well. So, in conclusion, the study will be completed March 2026. Results will be available around that time. I think it will be early results. We're just into the stage now of doing the training and then starting to take on and do. Um, Start the conversations, have the staff do that and work with that. We're sitting at a bad time over the summer. And so I think it's going to take a bit longer and will be implemented more so in the fall. Again, as I said, the results will be used to adapt tools and materials as well as sharing tools for other organizations across Canada to use. And it is an important way to make a start in addressing mental health needs for older adults. For some of these older adults, the only person they see is their social health and social care provider. They don't see family a lot. Their family may not live where they live. They may not have a lot of friends. They may not feel comfortable going out anymore. And so those are all the things that where if we can think about starting the mental health conversations at this point, I think it could be a real win-win for older adults. So these are just the references, and that is my presentation.
Awesome. Thank you so much, Dr. Oki, for sharing your wonderful work and the amazing work you are doing to break down that stigma on older adult mental health. So that's great. Does anyone have any questions? We do have two so far, but if you want to unmute yourself, just raise your hand, and that's all good with us.
And do you want me to just go stop sharing?
Yeah, sure.
Okay,
Yeah, perfect.
I just need to get back to the Zoom.
Yeah,
Oh, I, okay, stop share. There.
awesome. Okay,
Sorry.
perfect. No worries. Yeah, so we have one question. The first question is, how do I go about finding a mental health caregiver? I am in pretty crummy shape mentally. I am in Vancouver and also am a UBC student. So I think this may be more like younger adult focused. Do you have any insights
Yeah.
on providing, like finding mental health care? caregiver?
Certainly, as a student
Mm,
at UBC, your health center will have mental health care providers, or can organize that for you, and they have a number of resources as well. So, I'd strongly encourage you to seek help at the student health services.
yeah, for sure. And I'm actually quite involved in youth mental health advocacy. So depending on your age, Foundry BC is a great resource. They're like an integrated youth primary care service. So they offer a lot of free resources, clinical care, and I will put the link in the chat quickly here. So definitely do check them out. They do have an age limit of 24, just keep that in mind, but they are an amazing resource. So please do take a look. I have another question here. How can I get a copy of the toolkit? Is the toolkit out yet or?
No, the toolkit is not out yet for public to
Mm,
be publicly available. It won't be out until sometime next year, when we do make revisions based on what we've done. The mental health continuum um, is available on that QR code. So you could download that.
for sure. Sounds good. Thank you so much. Any other questions? Oh, oh wait. Yeah, someone had another question. Could you please explain the living toolkit? Bracket plant.
Oh, yes. So this was in one of the workshops, there was a plant obviously there. And so they got into this thing about a plant and how a plant can help people, think about themselves, think about where they are at in their mental well-being. We all know that horticulture, being in the garden, and those sorts of things do help. Uh, help people in their mental health and mental well-being. So that's how it was going to be. And then also, it was going to then have an actual living plant, and have a piece around there talking about the different pieces, and thinking about reflection, and how is your mental health, and how you might, if you have to care for a plant, thinking about caring for yourself as well.
Great.
Can
Thank you.
I ask a question?
Yep.
I've worked as home and community care for many years, and my catchphrase was always the three-dimensional interaction with an actual face, with an actual person, is more helpful than the television screen that the elderly sit in front of. And I wondered if you knew of any research around that, because even the plant idea is a three-dimensional thing. And I think my very uneducated version is our brains are wired for three dimensions. They're not wired for two dimensions. Your comment, please.
Yeah. Specifically on that, no. And so it's an interesting concept, though. And probably worthwhile for someone to have a look at. But I am not aware of anything that is out there. I also have to say that the living toolkit,
Mm-hmm.
actually didn't move forward as a way um, like as a tool to use in the toolkit. And I think, it's a little bit more difficult to transport. You have to purchase those, and so there's all of those sorts of things that align with that. I know there was also, a lot of talk about about like a community garden or space outside, and things like that. And again, that did not make it into what was recommended in the toolkit. So
Okay.
yeah, unfortunate.
It would be a
Um,
great research project, though, because I honestly think our primal brains are wired not for two dimensions, right? Anyway.
yes, yes, absolutely. Thank you for your comment.
That's good. Great. Priscilla, you had your hand up?
Hi, I just was trying to make sure I understood, Dr. Nally, what you're saying. Is this study then when you roll it out, is the people going out to take care of people, like the caregiver, you want them to be trained in this?
Yes, that is
Yeah.
correct. Yeah,
Okay. So
because yeah,
sorry, go ahead.
because they currently don't have a lot of training around mental health.
Yeah. No, and I can attest to that, being I have a partner that has Parkinson's and dementia. And we have people that come in for the walking program as well as that. I just don't know where you'll get the buy-in from, like VIHA or these agencies, to train their people to do this, because they are, as one of the comments made, they are so oversubscribed in terms of the services.
Yeah.
And the other thing is, and again, I do not mean to sound racist when I make this comment, but a lot of your people that are coming in as caregivers are from another country, and I don't think that they are equipped to be doing this kind of work when they're first starting out, and I don't know in the future what that looks like. So those are just some of my thoughts. But then a proactive thought would be, is there any thought of approaching private caregivers that then agencies that if they were willing to take this on and integrate it into their business model, that they would be differentiate themselves in the marketplace for people that are kids that are wanting to have their parents taken care of or whatever, that this would be something that would be better than publicly funded services.
Sorry. You've hit on a lot of different points, Priscilla, that are very valuable. First of all, yes, we know that they don't have training or little training in mental health, and they're focused on the physical because that's what they're supposed to do. And so, how do you get this into our mainstream organizations? I think that is a bit has been a bit challenging for us as well. Um, I would say, particularly in British Columbia, maybe less so in Ontario and Nova Scotia. But we have really gone into those community service organizations that provide some housing, some of them, or provide community visits, and then some of them also provide actual care. And so they're not private organizations per se, but they're not for profits. So we have been able to access a lot of those organizations, particularly I would say in rural, because those are the organizations that seem to be out there. We have also tried to engage private, so we're not opposed to that as well. And definitely, many of us have used private folks to, take care of our parents or others in our circles. And so, that would be very helpful as well to do that. So we're open to all of those kinds of organizations, I would say. And we've been specifically very broad in our coverage in this study to better understand what works well for different organizations as well. Yeah, I think that's, just with regards to who the care providers are. And again, I think this works back to, ensuring that they have the training. And particularly what we're doing is training here around mental health and mental health conversations. I can't really speak to the other training, but I hear, what some of the challenges are.
And I guess my last, thank you, Dr. Nally. And just my last comment is, what would you suggest us as the potential clients and people that are already clients and caregivers, like how to promote this, how to get the government or get healthcare agencies? What should we be doing to be proactive to fight for this?
Yeah, advocacy. And I think such an organization as the BC Brain Wellness Program would be one great way. But I think it's about each of us saying and putting our hands up and saying, this is important. This is important. Whether it's in our own, I was a caregiver for my father. And spent a lot of time in doing a lot of this work. I have training as a nurse, but I wasn't there. In fact, he was in a province over. And so I constantly talked about mental health with, in being able to do that. But I think it is, and I constantly still advocate with healthcare, like health authorities, with community-based organizations, when people are talking about this in nursing school. I talk about why we need this. And because nurses, they manage those caregivers oftentimes. And so that's another link that we need to have. So I think it's about, finding organizations, doing that formally, but also continuing to do that informally where you can find the places to do that.
Awesome. Yeah, thank you so much for the question. We just have a couple of more. I have two questions here that are kind of similar. There are more so on the care partner side. So the first question is, I'm losing both parents to dementia and I'm on my own, feeling very lost. My health is circling down the drain. Where do I turn? And then the other one is, does this include like the care partner, like the spouse, like the care partner as the focus of the mental health conversation as someone who needs like mental health care? So like the care partner side, any resources?
Yeah, that's a really good question. And I hear you. Caregivers are very at risk for mental health concerns as well, and mental well-being. Burnout is a huge issue. This project specifically focuses on older adults themselves, but if we have a care provider that is in the the in that mix, then absolutely, we would not turn down that area. It's another huge piece that where there is limited research and limited resources available, because then you're sitting in the mix of just regular public resources, and you know how difficult those can be to get. So again, ensuring that, number one, that you have a friend, have another family member or whatever working together with you, but also just having that opportunity to have socialization is really important. And then seeking care through, Family Caregivers of BC. That is one organization that you can definitely access in British Columbia. Again, they will have some pieces, but there isn't a huge amount, but they do have good resources and that sort of thing. But if you need actual care, you need to speak to your family physician provider or an NP that is looking after your nurse practitioner that is looking after your care.
Great. Thank you. And someone stated that VIU, so I assume Vancouver Island University, currently has a mental health care aid program to help address this gap in knowledge. And someone asked, are the toolkits for identifying a mental health issue, then helping the person get professional help? Do the toolkits provide tools for the older adults having mental health issues such as anxiety? Because I know you said it wasn't for diagnoses, right?
It is not for diagnosis because a care provider, like a health and social care provider, cannot diagnose. This is one of the big concerns that some of the organizations have is that they're into things that they shouldn't be into. But our piece is if the people who are there on a daily basis or weekly basis aren't asking about questions about their mental well-being, then who is? And so we've provided these tools to help people if they need help, then they're at that stage. Or to think about if you're thinking about on that mental health continuum, maybe you're just at that first stage where you need to take note. And so the care provider can also then take note of doing at that point in time and then ask a week later, a month later, and see how things are going. And that's what the toolkit is meant to do. Yeah.
Okay.
Oh,
Thank you. And oh, I'm sorry I missed two questions at the top. Someone asked, can we get a copy of the slides? Because it's recorded, are you okay if we just attach a copy in the follow-up email? Okay,
yeah, yeah.
perfect. And someone's asked, is there a list or resource for free or affordable mental health services or counselors with experience in dementia for families impacted by dementia and struggling with mental health challenges?
Yeah. So for dementia specifically, the Alzheimer's Society is really your best bet. This is not meant to specifically deal with dementia patients, but we know that the clients that we are dealing with oftentimes have some dementia. Um, for the care providers themselves, again, what I was going to say is many of the resources and tools that we are using are also helpful for care providers as well. Um, yeah, Alzheimer's Society, yes, you can share the slides, and I will get back to you, Lily, about the mental health resource list.
Okay,
Can I say something?
Yes.
I just wanted to respond to that remark about immigrant folk working on the front lines. One of the things that we need to remember is in Africa, where I worked for 20 years, the resources like dressings and the medical stuff is not there. What the people have as a resource is communication, conversation. They focus more on mental health than we do in our first world countries. So to say that they can't handle that, I think we're
That's
missing
yeah.
a big resource that we're not tapping into.
Yeah, and sorry if I said that and
No,
or
it wasn't
yeah,
you.
yeah,
It's someone else. But
yeah,
it is a resource that they are really good at mental health because that's often the only resource they've had to
yeah,
nurse people with.
yeah, and absolutely. I think it also depends on who the care provider is, and yeah,
Yeah.
you know, uh, lots of different approaches, etc., that are used.
great. We have one more question. Someone asked, oh, me one second. Oh, someone just mentioned social workers can also provide support, counseling, and your family physician may be able to connect you.
That is correct.
Mhm.
The other thing that you have is the Mental Health Association. That's another organization that is able, where they can connect you to mental health resources as well.
Perfect. And oh, there's so many good resources in the chat.
Yes,
And
yes.
yeah, and when I will send a post-event survey, but I will make sure to collect all the resources and have them in there. And if you're in the chat and you provided a resource, it would be great. If you can send us an email at, give me one second, brain.wellness@ubc.ca, so we can take note and make sure to include it. That'd be lovely. I don't think there's anything else from any other questions that I've missed. Hopefully not. I'm just double checking. All right. Okay, I don't think I've missed any. So, yeah, so this is the official end to the event, everyone. Thank you so much, Dr. Oelke, for sharing your amazing work on older adult mental health and all the amazing work you do to, like I said, break down that stigma. Thank you all for joining today and wishing you all a lovely rest of your week.
Thank you, everyone.
Thank you.